Anytime you're dealing with cerebrovascular disease, there's a chance for things to go wrong, and if they do, it can be very consequential, and so people are not always comfortable with that. There's not really a way for anyone to be at ease with the fact that they're going to have a procedure on a blood vessel inside their brain. It's going to be minimally invasive. Generally, it's going to be smooth, but that's not something that people can just easily absorb or be comfortable with. You have to focus on making people as comfortable as possible given the situation that they're going through. And that may mean just being there to listen to them and to hear their problems, even though there may or may not be anything you can do about it. At VIP, if there's some way to make you more comfortable, we will do that. And that may mean just talking to you more ahead of time. If it means another clinic visit before we schedule the procedure to just go over any concerns you have, that's the kind of thing we easily do without hesitation. If it's a simple question, you can call the office and we'll call you back within a day, no problem. It's not like you have to get through a giant switchboard or anything to get our attention. On the day of the surgery, you already know us, you've already met with us, you already understand what you're going to be going through. So as much as anybody can be, you're prepared. I do try to relate to people on a basic level, and I think it's important to just have them understand. I like to show people their own pictures, their own neuroimaging, whether that's an MRI or an angiogram, so they can see for themselves. Because in a lot of ways, cerebrovascular disease is really just, it's like a high-end plumbing problem. And if you can see, well, there's blockage here, or here's the aneurysm, this is a weak spot where it's going to need to be repaired, or there might be a leak, or here's a narrow point where you're not getting enough flow and that needs to be corrected. That's something that most people can grasp, and especially when they see the pictures themselves, I can describe it to you. It's often more powerful, and you can understand what we're going to do then a lot easier. And describing a lot of technical equipment doesn't really help you as much as say, I'm going to open up that vessel so the flow is better, and that will decrease your risk of stroke.